Good afternoon, and welcome to Ask the Doc. This is the monthly program where we give our audience the opportunity to ask questions of our experts in Alzheimer's disease and dementia. My name is Dr. Megan Whitbrocht, and I'm the host of Ask the Doc. UCI Mind is one of 37 Alzheimer's disease research centers that are funded by the National Institutes of Health. Today, we have a unique topic, male caregiving, and we are joined by Dr. Michael Bueno. Dr. Bueno is an associate clinical professor and the pre-licensure director at the Sue and Bill Gross School of Nursing at UC Irvine. Welcome, Dr. Bueno.
Hi. Thank you, Megan. Thank you for having me.
Of course. And to our viewers, thank you for joining us. If you have questions, just put them in the chat and we'll get to them in order. So let's get started. Dr. Bueno, I wanted to ask you first, how did you get involved in nursing and why did you choose male caregiving as a field of research?
Great question. So I got into nursing. My whole family's been in medicine. My father's a physician. My mom's a nurse. My older sister is also a physician as well. So again, the medical field has always been something that I've been drawn to and have experienced. But I went into nursing because I just like to work with people. Just giving the aspect of being there at the bedside. I've been a nurse for 16 years, so I got to encounter so many lives and experiences. And that's, now that I'm a professor of nursing, that's my one way of giving back to the community, teaching the future nurses who would touch more lives in that sense. So it's been something that I've been continually passionate about in my career. And that's how it got me into just the whole topic of caregiving. I've come across not only the patients, but one aspect that I felt that there wasn't a lot of attention to were the other people in that room when you're caring for that patient, the other, who is taking care of them if they were so focused on this person in that bed. So just getting along with all the caregivers, just the tough work that they do and the lack of attention they did, that's what brought me into looking at caregiving. And then more specifically in male caregiving, it's, of course, myself being a professional male caregiver, that's kind of like something that I've personally experienced, but in my own sense of getting interested into it, both my grandmas had dementia. So I watched both my grandpas take care of their wives and saw like the struggle that they have or just their experience. And during COVID, my brother-in-law also had dementia and died from that, and also watching my father-in-law and their family go through it too kind of really highlighted that men and women look at caregiving and their experience a lot differently. And the resources, especially when we try to provide some of these resources, are not very friendly to men in what they need. So that's what got me into doing my research, because even the current literature, there's really is a lack of research out there focusing on that male caregiving experience.
So can you tell us what the current landscape of caregiving looks like right now? Who's providing care, male versus female? What does it look like?
Yeah, so right now, the current statistics right now, there's about over 63 million Americans providing care right now, which is, again, a 50% increase since 2015. And we're just going to see this exponential growth of our older adult population, meaning more caregivers are going to be needed to take care of those. So when we look at just the growth of caregiving, we still see the majority of family caregivers are going to be female, but we are seeing this big growth in men entering that caregiver role. For instance, back in 2009, 33% of family caregivers were men. But then more recently in 2020, that went up to 39%. And one thing that caught my eye in the literature is that sometimes men being reported themselves as caregivers, it is underreported. So we can probably see that there could be potentially more men that are providing care, and they're just not identifying themselves as caregivers in that kind of sense. And not only that, we're starting to see, like, even when men enter these caregiving roles, they tend to be younger. And then so we're really not capturing those experiences there. And another interesting fact is, what we don't capture in the caregiving statistics is, even this young children are having to step in and assist their parents in taking care of their grandparents, and that's not really captured in those statistics as well.
Mm. Tell us about the experience from your research, female caregiving versus male caregiving broadly.
Yeah. So one of the big issues when it comes to both male and female caregiving, that it is a tough job, that there's a lot of consequences to it. Meaning, they can develop a lot of burden. There's a lot of social isolation that can lead to depression and anxiety when providing care, especially when someone who they're caring for is very fragile, or even if the caregiving their task and their role of being a caregiver is pretty lengthy, and especially with Alzheimer's dementia, where they progressively get worse and they can live for many, many years, that really can cut into their lives, especially their work lives, their personal lives, their own family lives. So it is, across the board, it's still going to be a challenging role, and the task needed to fulfill that role could be very, very cumbersome and consequential. But what I learned in my research, that the experience between men and women, although everyone has their own individual experience, men and women can approach that role quite differently, and the consequences might affect them differently as well. But it's all going to be different depending on when it affects them, or how long, or even the quality of care is going to be quite different, depending on who's providing the care. But still, in the literature right now, that is the big issue. There is not a lot of studies done on male caregivers, or even doing looking into the differences when it comes to male or female caregiving as well. So it's something that I wanted to tap into, and where I got my where I wanted to focus my research on, and hopefully I can answer more of that questions the more I do more look into it in my studies.
You describe male caregivers as struggling with unfamiliar roles and having to reshape masculinity. Can you describe that?
Yeah. So if we look at, especially for older adult caregiving with Alzheimer's dementia, the majority of the studies that looked at it, or the people I talked to in my studies, it really is like a lot of the spouses, especially the male spouses. So they tend to be older. They come from an older generation. So back in their generation, when they were growing up, a lot of the caregiving tasks were very what they considered feminine, where it came to hygiene, feeding, cooking, a lot of the housekeeping tasks, where they weren't expected to do that in their younger ages. Even with like those similar tasks when they had children. The men said that they wouldn't participate in that because they were in charge of bringing home the money to care of the family, rather than doing the child rearing or the housekeeping tasks. So when they were thrust into that position, sometimes abruptly, or even if they were kind of avoiding it to understand what they really wanted, that role became very unfamiliar, where they weren't used to cooking or providing hygiene to a child, let alone their spouse, right? Things like that became very unfamiliar. So a lot of the topics became really coming up with that concept of masculinity versus femininity. As a guy, they weren't expected to do that. It was a female's job. So those are the things that become, although there's a lot of men who are stepping up to provide all that they are comfortable, they're willing to learn. That's where they felt like their viewpoint of what masculine is does change, and that old sense of what society expects of them, is changing. They don't have to listen to that. That they can make their own. They don't have to feel unmasculine just for providing certain things, because that's what society says is what a man should do or shouldn't do. So it really is having them learn this whole new role, and being unfamiliar right at the start, because they weren't used to that throughout their lifetime until now.
And do you find that that is sort of dependent upon generation, so that younger caregivers, that doesn't seem to be as much of an issue?
I believe there's to some extent that is true, where older, maybe the younger generations, especially with everything that's going on in society right now, with how we should look at, gender roles in society, where again, where more women are entering the workforce, where more men are staying at home. That could tend to be true between the generations. But I think we're at an interesting time right now where, in our social political climate, that starts to come into question again. So we could see a trend going backwards again, to seeing how maybe these younger generation of men can see themselves. It's all interesting right now, and we just don't know. But there is some kind of generation look at what we see, where again the younger male caregivers might be a little bit more open, because we're seeing that they're more involved in raising a child. So when they have to take care of either a parent or a spouse, they might be not as not they can be a little bit more comfortable, because they were familiar, because they were involved in those kind of tasks growing up.
Mm-hmm. Now, in your review, you found that overall women caregivers have more negative outcomes.
Mm-hmm.
And male caregivers have a more difficult time in the initial transition. I assume because of these things that you spoke of, that they have a difficult time adjusting to these tasks that they never
Mm-hmm.
did. Do these male caregivers eventually do a better job of adapting over time, or why are you finding that women end up having these negative outcomes over time, or do worse over time, versus men?
And that's an interesting concept too, because yes, like in my research, yeah, men tend to have more burden right at the beginning of their role, but then overall women still become a little bit, report more burden in the overall sense. But the big problem lies into just the disproportionate amount of men in those studies. When we
Ah,
look at caregiving studies, we don't really see a lot of men participating in those. So even though we have that data to say, women might have overall greater burden, it's hard to say, just because we get that disproportionate number of participation.
yeah,
So although preliminary, yeah, the data might say that, I think it's just still too hard to tell unless we get more men to participate in those kinds of studies and do more of those studies too.
yeah.
So again, there's so many unknown in this realm of research, that more just needs to be done so we can get a better picture.
That makes sense. What is the term finding the right kind of support mean to you in terms of male caregiving?
Okay, that's a big thing that I found, because right now when we look at caregiver support, not only in just the what they're trying to find and what they need, it's really comes down to the support they need for themselves. When it comes to support in providing the care, finding the education or the training to do it, I mean, the resources are out there. But when that term really reflects trying to find the right care for themselves, a lot of the caregiver support, when it comes to psychosocial support, there's very limited. And then the ones that are available, the most common kind of support for caregivers for their own mental and social health are, say, support groups, where they're able to discuss with others in similar situations about their struggles, and maybe provide some help and at least some socialism within other caregivers. But the men that I talk to, those kinds of like support groups are not probably the best outlet for them to find that support, or at least in the sense that's available, that's out there. Um, I've had some caregivers tell me like, oh, in my research, one person told me, is like, oh, I don't want to sit in a big circle talking about my feelings, right? So things like that, or especially like if it's a mixed gender kind of support group, sometimes there was a couple feedback where they're, even though they didn't say it outright, in one way or another, they're saying they're not comfortable speaking out about their feelings across other men and women in the same group. And maybe what they're looking for is just maybe support groups within, just caregivers that look like themselves, like men only support groups. So they might be a little bit more open to talking about their struggles, their own feelings, things like that. Or even if it's not a support group kind of setting, could there be a different intervention where they can have a similar, find that similar support, but maybe not that traditional sit around in a circle, talk about struggles, talk about that feeling sense that they're really wanting to be more comfortable in. So those are, when it comes to the right kind of support, it's hard to tell because there really is not much out there that
Mhm.
kind of tailors to what men were like really more comfortable with.
Mhm. So your research on family caregivers managing medical and nursing tasks at home revealed the phrase doing the right thing. What does that mean to caregivers?
Well, doing the right thing just means just making sure that they're doing it correctly,
Mhm.
right? Like having the resources and the training to really make sure that they're doing right by their spouse or their parent or their neighbor or their friend. So they really are wanting to do the best for them, but making sure that they have the resources or training available. Um, it's, at least for men, they're saying that they want to do the right thing even if it's uncomfortable. They're still willing to do the right thing even if they're not out there um, being vocal about it. They still want to be able to provide, and do the right thing, not only for themselves but for the person they're taking care of.
Yeah. What types of complex medical tasks are being asked of home care providers, family care providers at home, that they may not be equipped to do or are equipped to do? But what are some of those tasks that family members are being asked to do?
Yeah, so these family caregivers are asked to do some of the very complex things, such as, for instance, providing wound care. If that person has open wounds, especially what we see in the older adult population, such as pressure ulcers because they're bedbound or things like that, being able to provide that kind of complex wound care, making sure that they don't get an infection or the wound, their whatever wounds they have doesn't get even worse. Other things they're tasked to is if they were providing for someone with lots of comorbidities. For instance, if this the family caregiver is having to set up a peritoneal dialysis, that requires a lot of technical training now. That family caregivers are even tasked to do, or providing many different kinds of medications. They don't know if it interacts with each other, or should they give um, a suppository, or even if it's not a complex nursing or medical task, but providing like bathing to someone that's not able to walk to the bathroom or to shower themselves, having to provide a bed bath, or do some of that typical hygiene things when that person is not capable to assist at all. It really is becoming more difficult because they are these patients are staying at home and requiring lots more family member support to provide all those complex tasks,
Yeah.
rather than if their insurance doesn't cover a home healthcare nurse to come and assist them, then these family caregivers are really tasked to do everything themselves.
Mm. Are there resources available for these family caregivers that can help with either training or, um, that people can come in and help them? Or what are some resources that can aid people?
Yeah, there are some resources out there. I mean, basic education. There's lots of organizations that will give them the basic education and training, but maybe the hands-on is a little bit more difficult depending on where someone lives. For instance, in California and certain counties, we do have really good organizations that do provide caregiver training, such as in-home support services, or IHSS. I actually participate and I do some of the trainings for these caregivers, where they come in and we go over topics of how to perform basic wound care, how to brush someone's teeth, or provide a bed bath. So some of these organizations are providing lots of times free of charge to just depending on the timing or where they're located, that they can do in-home training. But outside of that, it is sometimes it requires some outside organizations to come to the home, provide some of that care. I know when, especially if that person is covered under a certain like Medicare, they do have a little bit of funding once they get discharged from a hospital, that there's a little bit of support right after that. But after that runs out, then again, it's really up to the family caregivers that have to pick up the slack. So it really is important for them to be present. But there are some organizations out there. It just really depends on where that person lives and what's available to them, if it's free of charge or there could be a cost that's attached to that too.
Great. What role does family, friends, the neighborhood play in supporting the caregiver?
Oh, they play a tremendous role in supporting the caregiver, because one of the big issues of being a family caregiver is because it is such a daunting task, is isolation. So, friends, family, neighbors who check in on them, even providing some, at least some like social interactions, especially if someone, caregiver feels lonely. But also one of the things that can help is like respite care. As being a caregiver, 24/7 caregiver, you don't get any breaks, right? They're always there, taking care of them. Sometimes they have to quit their job. So that is solely what they're only doing. It could be a little bit of financial help, but really just being there as a social support, providing a little bit of respite so they can take a little breather, there it becomes an important thing. And we're seeing that, yeah, when it comes to caregiving now, it really is, that old saying, it takes a village to take care of someone. So it really is, because having this one-on-one, it becomes really, really challenging. So yeah, everyone else in that person's life, whoever is available, plays a major role in that caregiver's social support group.
I'm putting you on the spot here.
Yeah.
What are the top 3 things that healthcare providers can do, and health agencies should do differently to support family caregivers?
I think it's just making sure that they're seen. I just remember in my own bedside practice, taking care of patients. Sometimes we only really like make sure the patient's going to be, taken care of, their discharges. Everyone's understanding what the discharge plan is, but even asking the simple thing of looking at a family who is going to caregiver is like, are they okay? Do they need additional help? Sometimes they just need someone to make sure that they've been asked that question, not only in the hospital, but maybe if it's in a provider's office, like when there's a regular healthy checkup, maybe asking that question of to that person who brought to that patient in there, asking how they're doing. Really, it is just, again, just making sure that they're seen and they're not forgotten, right? Because there are some studies that show that out there, that sometimes the caregiver actually develops like a more severe illness than the person they're taking care of, because they aren't taking care of themselves.
Mhm.
So that's one of the things, is just, again, just making sure that they're part of your assessment. It's not just the patient, but asking the caregiver, are they okay? Are we able to provide support to them, or at least give them resources to know that there is support for them. And then another way to address it too is when we do acknowledge the caregiver and what health they need, that it's not a one size fits all kind of support. As we've seen, even between genders, men and women look at different support, and what's more effective might be a little bit different. So something that we need to do is again, just be a little bit more tailored in what we provide them, or the questions that we ask. And then thirdly, it's what we providers can do, maybe just what the whole medical community can do, is we need to do more research. We really do. We need to find different kinds of interventions, diversify the types of support we can provide caregivers, because maybe support groups is not going to fit for everyone. There could be other things that's out there that certain caregivers might provide, that or might need, that really is not just that one size fits all approach.
Can you give us a few examples of what a male caregiver might need that's different from a female caregiver?
Great. And that's good. I mean, that's the one of the next steps of my my research is trying to find what those differences are. But there are some organizations out there that I found that are at least addressing the differences in what male caregivers are needed. There is an organization called the uh, out in the Midwest. I forgot their name, but the way that they provide male caregiver support is instead of a traditional, say, support group in a room where they talk, they actually take guys out to, like, these caregivers to a car show where, they open up and maybe just being in more comfortable environment, the men are more comfortable to open up about their feelings and their struggles. So like changing the scenery might be a little bit different, or there are some interventions out there. Yeah, well, one of the other not simple, but one straightforward way is creating more male only support groups, where it's more men supporting each other in that kind of sense. Um, Other ways are doing it in coffee shops. Again, a lot of it comes with just changing the scenery,
Yeah.
where men are more familiar. I know there's one intervention that they're trying to plan to do is doing a male caregiver support group, but in a it's almost like in like a woodworking shop where there's a task provided to them. They can be a little bit hands-on, and maybe that could break down some of those walls where they can be more open. Things like that could be something a little bit more familiar for men who are looking for that kind of support.
Yeah.
But again, everything's early on. We need to do more research on what actually is effective and doable for these populations.
Mhm. Is there anything else in terms of your research moving forward, or are there other things you're exploring?
Yeah, other things I'm exploring. My next move, I'm actually looking into not only just how gender affects the caregiving experience, but then certain cultural backgrounds, how they experience it. For instance, I did a concept analysis on how different cultures look at masculinity when it comes to caregiving.
Yeah.
So seeing how that affects how someone either experience their caregiving or experience how they reach out for support. Like for instance, a lot of male caregivers of Asian backgrounds. Sometimes a lot of the burden comes from their expectations. Like the male child are expected to take care of their parents. So maybe is there some kind of level of burden that's attached to that? Or when it comes to Blacks and African American, there is a sense of racism and discrimination when it comes to even looking for supports, and how do they deal with that? Or do they try to avoid it, things like that. So I'm looking really into other factors that could affect how caregivers either approach their caregiving tasks or approach support for themselves. So that's part of my next steps in my research.
Yeah. Is there any message that you want family caregivers to go away with today?
Yes, my main message is you are seen. There are people that are looking into caregiver health, and that although you are caregiving or you're caring for someone who needs incredible amounts of help, that they should also not forget about their own physical and mental health. That it's important that so they don't become a patient themselves, to really be able to look at those, take some time to at least focus on themselves, to not skip out on their own healthcare visits, right? Look out for support, and especially for men, there's this sense that I want to look at interventions where male caregivers, it's okay to ask for help, right? You don't have to do it yourself. That there are other people in your situation, so you don't have to live with some of these feelings on your own, and that there are things to make your job at least a little bit easier, at least have reduce some of that burden for yourself. That there are resources out there. You just have to, again, just ask, be open to asking.
Hmm. Dr. Bueno, if someone wants to get a hold of you, either a caregiver or a healthcare provider, how would they get a hold of you to learn more about your research or just to talk to you?
Yeah, the best way, just email me at my email right there that's shown on the screen. I can always direct you, even if I'm not doing research on that. I might know someone who might be available or might be doing a topic around what they're interested in. But yes, please email me so we can find out what the best route to be a part of, to help assist you, be part of a research study, or I can direct you to what kind of supports are actually out there. Sometimes it's just not advertised. It's hard to tell with everything that's available out there. It's hard to kind of sift through those weeds.
Dr. Bueno, thank you so much for joining us today.
Thank you. I can't say how much this topic is very important to myself, and just to reach out to all the caregivers out there. They do incredible work. If they weren't here, this society would collapse. we really need these caregivers, and we need them to stay healthy, because we're going to need a lot more of them.
Yeah, and what an exciting field of research too. It seems like it's wide open for exploration as well.
Exactly, it is.
And to our audience, thank you for joining us. Our last episode of Ask the Doc for the year. We have an exciting lineup for next year and some surprises. So join us next year. If you're interested in participating in research, join the UCI Consent to Contact Registry at c2c.uci.edu. You can learn more about our content at Mindcast, and we'll see you all next year. Thank you, everyone. Bye.